All right, I was told that nobody could hear me. So gonna ask for some help. If you guys can hear me, give me a chat and let me know. All right, it sounds like we can hear me now, so I'll start all over. That's all right. It's a Tuesday, but a Monday for me. So, okay. Well, happy Tuesday, everybody. My name is Jackie Connery. I am the Community Health Nurse Supervisor with Two Rivers Public Health Department. So just welcoming everybody to our monthly surveillance call. All right, so the first page, first couple pages are always the same, but just good reminders of the 7 counties that we oversee. So Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. This is just a little bit of what we do at Two Rivers. And then our mission, vision, and values. And then this slide, we're going to keep in there for you guys. That way you guys can get to know faces with our names. So we have me, Jackie Connery, Community Health Nurse Supervisor. We have Rosa Pinion, our program nurse. Marilyn Warnken, she's also a program nurse. And then we have Rita Call, a community health nurse. Liz Weems, a community health nurse. And Jordan Anderson, community health nurse. And this is just a reminder that our website has changed. So we, of course, want everybody to make sure that they can contact us. It used to be trphd.org. Now it's trphd.ne.gov. So make sure that our email addresses have changed for you guys. And if you want to search for Two Rivers website, make sure to do trphd.ne.gov. This is just a reminder that we're in Region 7, so it's a little, little different. Okay, now we can get into the thick of it, right? So COVID by the numbers. So this was updated September 12th. Total US confirmed cases, we're at 94,973,074 now. Our 7-day average per 100,000 people is 142.1. Total US deaths, 1,044,461. Total Region 7 confirmed, 3,885,795, and total Region 7 deaths, 45,046. So we do have them kind of spaced out for you guys so you can see Nebraska, Kansas, Missouri, and Iowa. So Nebraska total confirmed 533,046, and total deaths confirmed 4,488. Kansas is a little bit higher. Total confirmed is 869,254 with deaths of 9,029. Missouri is even higher with 1,636,260 with 21,561 deaths. And Iowa is about the same as Kansas, but 847,235, and deaths are 9,968. We also have on the map where we put the 7-day case rate per 100,000 by state. And I always like to put the surrounding states. That way you guys can kind of see where we're stacking up. So some states are doing a little bit better than us, but we're kind of right in the middle. This is our dashboard. It is a little bit different than last time, so you guys will probably keep seeing some changes here and there, but would like to point out a few things on the dashboard. So on the top left, you can see that the 7-day rolling average in cases during 2022, or the orange line, dropped below numbers of cases we were seeing in 2021, shown by the blue line. Looking at the bottom left, you're able to notice that the number of positive cases reported in red versus total cases. There is a fluctuation from week to week in these numbers. When we look at the bottom right, you notice that the majority of the cases are reported in those ages 60 to 69, 20 to 29, and people who are over 80. And then the top right is probably our newest little picture. And you can see the current COVID-19 community levels in Nebraska as reported by the CDC. This is our second page for our data. So this is a Trphd hospital data. So some quick takeaways from the hospital information. When we look at the percent of beds occupied by COVID-19 patients on the top right, we can see a steady decrease during the month of September, which, yay! The graph of COVID hospitalized shown in green and yellow on the bottom right, the fluctuations in the graph tend to follow the trends in cases in the district. This graph also shows our recent decrease in cases. On average, about less than 10% of the hospital beds occupied are occupied by COVID-19 patients. And there are 7 total inpatient COVID positive patients as of September 8th. All right. So we do have our COVID data tracker weekly review. So this for September 9th, they came out for a reminder for fall boosters. So September 1st, CDC recommended that everyone 12 plus and older receive the updated COVID booster. Before a possible surge in COVID-19 illnesses later this fall and winter. These updated boosters help restore protection and also give extra protection against the most recent variants. The updated booster is a bivalent because it targets 2 Omicron subvariants, which are BA.4 and BA.5. And then at the very bottom, there's a note to readers. Flu season is approaching. CDC recommends getting both a COVID-19 vaccine and a flu shot at the same visit. If you haven't gotten your currently recommended dose of COVID-19 vaccine, get it as soon as you can along with your flu vaccine. So just wanted to make sure you guys saw that. Okay, monkeypox outbreak. So we do send this out to clinicians weekly. So this does change every week. So we track the monkeypox outbreak. We send this out weekly. Numbers continue to rise with 21,274 confirmed cases as of September 8th in the US. We have 28 confirmed cases in Nebraska and 56,026 cases globally, which have been found in 102 different countries. So CDC is recommending vaccination against monkeypox using the following strategies. So we've got the post-exposure prophylaxis, the PEP plus pre-exposure prophylaxis. So if you guys are interested in vaccination, please let us know. We have a little QR code that we always send out. You guys can scan that and then the information will come to us. But if you'd like to just call me as well, you can just call and let me know. We'll get something set up for you. Okay. So August 30th, CDC had a health advisory come out. So the background of this, so 5 cases of human infection with influenza viruses that usually spread only in pigs, also known as variant influenza virus infections, were reported to CDC in August 2022. These cases include 3 infections with influenza A, which was an H3N2 variant, virus and 2 infections with influenza A, H1N2 virus. These cases were identified in West Virginia. There was 3 of them, Oregon 1, and Ohio 1. 4 of the 5 cases reported exposure to pigs or attendance at an agricultural fair prior to illness, and 1 reported no contact with pigs or attendance at an agricultural fair prior to illness. Clinical characteristics of these cases have been similar to those of seasonal influenza infections and have included fever, cough, pharyngitis, myalgia, and headache. No hospitalizations or deaths have occurred among these 5 cases, and all patients are recovering or have recovered from their illness. To date, no person-to-person spread associated with the 5 recent variant influenza viruses infections has been identified. So I did put the link on the bottom of the page for you guys. If you don't get the HANs, you can go back and you can read all the ones that they come through, and that it will include this one as well. Since we were talking about flu, I decided we probably should start our flu view tracking. So I do have the most updated map. We are in week 35, which is the week ending September 3rd. So big takeaway from this is Nebraska, we're in the green. So we're in a minimal activity level. But you can see that Texas and New Mexico are in the high area already. So, and it looks like the Mariana Islands are also in that moderate high area. So it's here, it's September, so we need to be watching for influenza. I also put the link so you guys can get to the flu view datas. And on the right of the page in the blue and the gray is the influenza weekly summary. So I just took a snippet of the top part. For week 35, it says for influenza positives, we had 4, which was down 1 from last week. And influenza B positives, we had 4, which was an increase of 3. So long story short, we're starting to see the influenza. We do track influenza and RSV, and we are seeing both of them in the data. They are starting to rise. So you guys can go to that link and you can see the full influenza weekly summary. The second HAN that we got was just the other day on September 9th. So this one is severe respiratory illnesses associated with rhinoviruses and or enteroviruses, including EVD68 multi-state 2022. So the purpose of this health alert is to notify healthcare providers, laboratories, infection control specialists, and public health departments about recent increase in severe respiratory illness requiring hospitalization in children. So they urge healthcare providers to consider EVD68 as a possible cause of acute severe respiratory illness with or without fever in children, and advise of the potential for an increase in AFM cases in the upcoming weeks, and provide CDC recommendations to healthcare providers, laboratories, infection preventions, public health departments, and the public. So another advisory that I thought was super important, especially this time of year. So the 2 pages back, I had the link for the HANs. So you can find the full HAN for this there as well. Okay, so staying up to date with COVID-19 vaccines, including boosters. So at the beginning of September, FDA did authorize the bivalents. So I wanted to put something in here for you guys so you had something to go off of. I know we've sent out some information, but just in a nutshell, we'll just go over who can get a booster, who can't. So 6 months to 4 years should get their primary series doses. People ages 5 years and older should get a primary series dose and booster dose recommended for them by CDC if eligible. So people ages 5 to 11 years are currently recommended to get their original monovalent booster. And then people ages 12 years and older are recommended to receive one updated Pfizer or Moderna bivalent booster. This includes people who have received all primary series doses and people who have previously received one or more original monovalent boosters. So at this time, people aged 12 years to 17 years can only receive the updated Pfizer bivalent booster. So there's just a lot in there, but I think it's very important, all these rules and everything, it's kind of getting to where we have to study it every day. So wanted to make sure you guys were aware. If you have any question, please give us a call. We'd be happy to go through it with you. I also put a little guy on there about find out when you can get your booster. So you can actually scan that little QR code and it will take you to the same page that has this find out when you can get your booster. You click on that green find out when to get a booster tab, and it actually will ask you questions and go through it to decide if you need a booster or not, or if you're eligible. So kind of handy. All right. Life Smiles Dental Health Program is holding free dental screenings on the following remaining 2022 dates. So in September, we will be in the Kearney office, September 21st and October 26th. And we will be in Lexington at the Community Action Partnerships, October 6th as well. Two Rivers COVID testing. So we still are doing COVID testing. We do this every Monday and Wednesdays from 9:30 to 10:30. All those wanting to be tested must register at trphd.ne.gov. And just an FYI, we also do have the free COVID test kits that we have been distributing through our office. We currently still do have some of those, and we just got a couple more pallets, but we have about 2,000 left. And once those are gone, we are out. So just wanted everybody to know, if you need to get some of those COVID tests, now would be the time. All right. So on the road again, we do travel quite a bit, and you guys are going to start seeing a lot more events. We'll be out and about a lot more. You can always go to trphd.ne.gov and go to our event calendar to see where we are. So today is the 13th of September, and we will be out at the Buffalo County Fairgrounds tonight from 5 to 7. So we will be offering it all. We will have COVID, monovalent and bivalent. We will have influenza, and we are also taking out all of our childhood vaccines as well. So if your child needs any childhood vaccines, you can bring them out between 5 and 7 tonight at the Buffalo County Fairgrounds. We also have this Thursday, the 15th, a VFC clinic in our office. So that you do need to call and make an appointment ahead. We do walk-ins, but we would prefer you guys to call and schedule if you can. So we do have another VFC clinic in office on the 19th. And you can see the dental clinic is on there on the 21st. A Holdridge clinic on the 21st. Kozag clinic on the 28th. And another VFC clinic in our office on the 29th. So busy, busy, busy. But also we are starting to do our influenza and COVID clinics within the schools and within nursing homes. So if any clinicians, if you guys are interested in us coming in and helping you guys with influenza or COVID boosters, please give Vaughn or I or Brent a call, and we will get you guys set up with a date. So that is all I have for today. So So I'm going to ask if there's anybody that has any questions. I see we have Leanne with a hand up. Leanne, do you have a question for me today? I'm gonna say that Leanne doesn't want to talk to me today, which is fine. So anybody else have any questions?
Jackie, there's a question from Laura in the chat, or maybe not a question. Family Practice Associates will be doing flu shots during the 1st and 2nd weeks of October. We would love to have help and offer COVID again.
Great, Laura. We will give you a call and we will set up offline. All right. Well, if nobody else has anything, once again, just like Laura reached out, if you guys need any help with COVID or influenza, let us know. We would be happy to help you guys out, and we're scheduling people now. So just let me know or give us a call. We'll get you the right person. So everybody enjoy their Tuesday.